Hello, welcome to the Learning Curve. I'm Marjorie Began. This year in the U.S. and around the world, thousands of women and hundreds of men will hear the words, "You have breast cancer." But there is hope for these individuals, especially today with the ever-increasing personalized care given to each patient. Here to talk to us about this subject is Dr. Asma Latif, medical hematologist-oncologist associated with Sturdy Memorial Hospital.
Thanks so much for having me.
Oh, it's so nice to have you with us.
Yeah.
So tell me, your title. Explain that.
What does that mean? So I actually work with a variety of different types of physicians and other staff members, really to take care of predominantly people who have various forms of cancer. And then a hematologist also looks after people who have various forms of blood disorders as well. My area of expertise is primarily in taking care of men and women with breast cancer. And I work with surgeons and radiation doctors to really provide complete care for those individuals. My focus is really on the medication part of the treatment of breast cancer. So a surgeon performs the surgery, radiation doctors deliver radiation, and I really focus on pill medications and intravenous medications that can improve somebody's health when they're going through treatment for breast cancer.
Mm-hmm. How long have you been working in the field?
I've been practicing as an oncologist for about 7 years now, a little bit longer as a general internal medicine physician as well.
When we talk about this subject of breast cancer, are there things that people can do to prevent?
Yeah, that's actually a great question. A lot of what we focus on when we hear about breast cancer and talk about breast cancer are treatments for breast cancer. But we need to remember that there are a lot of things we can do in our own lives that can improve our general health and actually reduce our risk for various types of cancers, including breast cancer. 1 in 8 women will be diagnosed with breast cancer over their lifetimes. And although no individual change can eliminate that risk, it's empowering to know that there are things we can do on our own to kind of lower that risk as much as possible. That starts with keeping a healthy body weight, especially after menopause. We know that fat cells in our body can increase the amount of estrogen in our body, and too much estrogen can increase the risk of breast cancer. So maintaining a healthy body weight throughout our lives actually reduces our risk of many types of cancers, including breast cancer. And that's something that a lot of people struggle with, but it's important to always keep it as a goal because everything we do in order to attain that goal can make a difference. We also know that daily activity is very important. So there have been some studies that show that women who exercise about 150 minutes every week on average have lower rates of breast cancer than women who are more sedentary. That sounds like a lot of time, but 5 days a week, 30 minutes a day can get you there. And so it's really important to try to incorporate as much physical activity in our lifestyles as possible. And then on that same line, we know that a very healthy diet can be associated with lower risks of breast cancer as well. So lots of fruits and vegetables, lots of whole grains, lean proteins, not too much red meats or saturated fats have been linked to lower rates of disease as well. So those are some things we can do, on a day-to-day basis that can improve our health. Staying away from smoking and really any tobacco products is important. And we're learning now that drinking alcohol in moderation is really important as well. So women who drink 3 or more alcoholic drinks a week have higher rates of breast cancer in general as compared to women who drink less than that. And so really moderation is important. And the last thing I'll mention is a lot of women, especially as they go through menopause, have symptoms such as hot flashes or difficulty sleeping, things like that. And so they may be interested in taking hormone replacement treatments or medicines that essentially give them back hormones to help mitigate the side effects of post-menopause. There have been some links to breast cancer for women who are taking long-term hormone replacement treatment. So it's really important to speak with your doctor to figure out what makes the most sense for you, and making sure that, you know, anything you put into your body, you understand what the potential risks are.
And people who may have a history of breast cancer or other cancers in their family, I think probably might be at higher risk.
Yeah, that's exactly right. So there are definitely families where breast cancer is common, and so the women in that family, and sometimes even the men in those families, are at higher risk to develop breast cancer. And then some people actually are found to have a genetic predisposition to breast cancer. So we've actually been able to isolate the gene in their body that they've inherited that's increasing their risk of developing breast cancer. So for those individuals, there's actually a lot that can be done. We have medications that they can actually choose to take if they wish. These are anti-estrogen pills that they can take in a preventative way. And if they're taken every day, usually for about 5 years, we know we can reduce the chance that they'll ever have to deal with a breast cancer in their life. And so for some women, they may choose to do that just to kind of avoid some of the illnesses that they've seen in their family members. And then there are women who have genetic predispositions to cancer with certain gene mutations, and so they may even choose to have a preventative surgery, such as removing their breasts. And that's really reserved for people who are thought to be at very high risk to develop breast cancer in the future. And the nice thing about that option is it can give women the chance to control what's happening in their body, but it's a very difficult decision to make, and often requires guidance from many different physicians, but also genetic counselors and the support of one's family as well.
Just the thought of it is scary.
Yeah.
I've known several women, close friends, that have been diagnosed with cancer. And the thought of going through the treatment and everything, they begin to feel like a science experiment. And in the beginning I was saying there's a trend to more personalized care. Can you talk about that?
Yeah, so what you're alluding to is something that I see almost every day. Cancer is scary, and breast cancer is really scary. And that fear surrounding that diagnosis can make it very difficult to move forward. But it's important to know that the treatments we have available now, as compared to over the last few decades, are really much better, and people actually feel much better on them. So there are a lot of really great options. In the past, we used to treat all breast cancer the same because that's all we knew. But now we've learned that individual people have different breast cancers that have very unique characteristics. So we have to look at each person with a very close eye. We have to look not only at their own health, but look at the tumor itself and look at the DNA and the genetic pattern of that tumor. We can learn about the vulnerabilities of that cancer that way, and then we can select a treatment regimen that specifically targets that individual person's cancer. And so that's something we refer to as personalized medicine or precision medicine. And what's so great about it is by doing that, we can avoid giving people treatments that won't help them and really focus only on the treatments that are beneficial. And breast cancer was really at the forefront of this, in this field. In the past, we learned that the majority of breast cancers were sensitive to estrogen. So in the presence of estrogen, these tumor cells grew. So instead of just giving somebody chemotherapy for their cancer, we learned that if we give them pills that block the estrogen in their body, we can actually starve out those cancer cells. And those pills are generally well tolerated, and people can live essentially a normal life as they take those treatments. We know now that about a quarter of women with breast cancer actually have too much of a particular type of protein in their tumor cells, and that's referred to as HER2/neu. In the past, these women didn't do as well in terms of the treatments for the breast cancer. The treatments just didn't work as well. But now medications have been developed that specifically target that particular protein and what it does in the cell. And we've kind of leveled the playing field for those women now. They can receive these treatments that we refer to as targeted therapies and really do just as well as their counterparts, women who don't have that protein in their cancer cell. And then the last thing I'll mention is that in the past, we used to really rely on just the tumor size and whether or not somebody's lymph nodes were involved with the cancer in order to make a determination regarding whether that person needed chemotherapy. And now we actually have the ability to test the actual genetics of the tumor itself, look at the DNA pattern of the tumor itself, and based on that, we're able to predict whether that person's cancer is very aggressive and that person may benefit from chemotherapy, or if that person's cancer is not very aggressive and even despite the size of the tumor, doesn't need chemotherapy. And so by doing that, we're really able to save a lot of women from going through a treatment that may have a lot of short-term and long-term side effects and a lot of emotional side effects as well. So it's a really exciting time.
It seems to be, and we hear people raising money for research, and research truly is helping this.
That's why we're in the place where we are with breast cancer, and I think the rate at which we're moving forward in terms of our future treatments that are going to be available is all because of the commitment people around the world have made to really supporting the scientists who are behind this work, the physicians, the researchers, and really everybody who's motivated to continue to improve the treatments as much as possible so that one day maybe we won't even have to be sitting here and having this conversation.
So it seems that, again, if someone were to be diagnosed with cancer, that it really is a much more personal type of diagnosis, and that so much more can be done, for them individually instead of being over-medicated.
Yeah, absolutely. Our goal now is to give only the treatments that are absolutely necessary and avoid anything that may not be, completely beneficial to a woman or a man who's going through this illness. And because of that, I think people do appreciate how much better their quality of life may be. The majority of women I take care of, even if they're receiving chemotherapy or other types of intravenous medications, can continue to work, can continue to take care of their lives at home and their families, and really remark to me that their expectations going into it were, they were in a situation where they felt that everything was over. And then actually, as they went through treatment itself, they realized that it was really just a small part of their life. And that's really our goal, to make our treatments as easy as possible so that people can be out there living their lives. Sometimes, actually, the most emotional part nowadays is when we finish those treatments, and then a woman can really remark at what she's been through and really make a determination how they want to move forward and kind of live their life to keep as healthy as possible, and that's really our goal.
So when Relay for Life puts out the word hope, there really is hope.
Absolutely, absolutely. Even for women and men who are in a position where they have a cancer that may not be as easily treated, our treatments and kind of complementary therapies that can be used in order to take care of them have really made amazing strides in turning cancer into more of a chronic illness that can be managed, that people can live with, and that's really our goal. And I think it's going to keep getting better and better with time.
It's so good to hear.
Yeah.
And we have been mentioning back and forth men, and we sometimes forget that there are men diagnosed. And I'm sure that they must say, what? I have what?
Yeah.
You know,
Yeah.
how do you deal with that?
Yeah, so that's a great question. As you know, most people are aware, men are generally not doing breast exams for themselves. They're not generally going for mammograms. But we do know that men have breast tissue, and so about 1 in every 100 breast cancers that's diagnosed, that's involving a man. And in general, the treatment is very similar to the treatment we offer women, and they can do just as well. So they also consider surgery and potentially radiation and potentially medications after their diagnosis itself. We know that if a man is diagnosed with breast cancer, we have to look very closely at their family history and oftentimes their genetics, because they may be at higher risk for having a genetic predisposition to that disease. And that's really important because we want to do as much as possible so that we can help that man be as healthy as possible going forward. You know, the biggest risk factor for developing breast cancer is having a prior breast cancer. And so those men then will go for annual mammograms, just like women do, and breast exams, and you know, and it can be very difficult emotionally for them because they are involved with a team of doctors who are primarily taking care of women. But it's really important to normalize their experience as well, and really help them through it as much as possible.
When we were talking and you're mentioning all the different doctors that are involved, people might say, well, I don't know this, I don't know this.
Yeah.
Are there caseworkers that really say, take over and work with the doctors and help the patient understand the steps?
Yeah, absolutely. So one of the most important things we can do for our patients as they meet us and kind of are under our care is really to provide them with a team of people who can be there to support them. And so one part of that team is their physicians, there are nurses, and there are social workers. But many cancer centers, including at Sturdy, have incorporated the use of something we refer to as nurse navigators. And these are people who are specially trained to help a person navigate through their journey with us. And that may mean trying to help them understand their appointments and who they're going to be seeing, helping to arm them with the questions that they may want to ask, but also taking a look at who is the family support for this individual, who is the person who's going to come with them to their appointments and take notes for them. You know, looking into making sure that people can get to our appointments, that there are no barriers to that, making sure that you know, we take the financial part of healthcare off of their mind so that they can really focus on their health and, you know, what they need to do to move forward. And so the role of the nurse navigators, and you know, they're called different things in different places. It may be a social worker or a case manager, is actually really, really important. And that role continues far beyond the completion of the treatment. You know, there are a lot of things that men and women have to think about after they finish treatment for cancer. That may include long-term side effects, that may include changes to their diet, for which they may meet with nutritionists, you know, concerns about swelling in their arm after surgery, for which they may meet with physical therapists who specialize in lymphedema. And so the nurse navigator can help them kind of face everything that's ahead and help them to be comfortable with the plan. And I think we recognize that that emotional support is just as important now as the physical support that we give.
I think it would be, you know, because just in your mind, dealing with the fact that you have this, and then your mind races and goes in 1,000 different directions, and how am I going to do this and whatever.
Yeah.
But to know that there's a team there and someone who can answer your questions and, you know, guide you through this, and to keep encouraging you that there is hope, and that new strides are, you know, there's new things are being developed every day, and new ways of dealing with this in a much more personalized manner. You know, as you mentioned, much more personalized.
Yeah, that's absolutely right. You know, nobody wants to meet me. in the office. Nobody ever wants to meet with me. But I think what is so exciting is that we are able to empower men and women to be able to take control of their lives, even when they may feel that their bodies betrayed them, to help them get back on their feet and help them to know that we can, move forward. And that team, is the team in the office, in the hospital, but that's their team at home who's helping them along the way with that journey as well. And I can't, emphasize enough how important that is to have, family or trusted loved ones, friends, a network of people who are going to be there for you along the way. And they make all the difference, in this whole process. But it is really an exciting time in cancer care in general, and especially in breast cancer, because of all of the new information and the new science that is out there. And I think that information can be overwhelming if someone isn't used to talking about all of this. But there are a lot of great organizations as well that really focus on helping people to learn about their own cancer. There are community support groups. There are online sites such as American Cancer Society that really work towards helping people get appropriate information that is helpful to them. And, I think that's really exciting.
Yeah, that's what, I was going to say. If people wanted to learn more about the subject, American Cancer, I think online.
Yep.
And I think they also have a 800 number where they're able to speak to people.
Yeah, absolutely. And then the other thing I'll mention is, with the way we refer to the nurse navigator or case worker in the past, they have generally have a list of community resources as well. Not only support groups, but oftentimes they can help match people up with somebody who may have gone through that treatment or that diagnosis in the past, and that's really important too. So looking to individual people who may have experienced similar experiences, and then having the broader kind of knowledge base with these online resources such as with American Cancer Society. Yeah.
Excellent.
Yeah.
Thank you for coming and speaking.
Yeah, it was my pleasure. Thank you so much for having me.
It's a horrible subject, but there's so much hope that is still there.
Absolutely, and that's the most important thing to convey.
Absolutely. Yep. Thank you
again.
Thank you. And thank you for joining us today on The Learning Curve. And I hope you join us again.